Good afternoon. It is a pleasure to be here. I'm very glad to be here to participate in one more FIS. FIS 2021 is speaking about healthcare and everything that we've been experiencing in terms of changes. Our panel today will be about digital transformation, health innovation with Armando Lopes from Siemens and Guilherme Ambar of Seegene. During the past 2 years, we've had so many learnings, also uncertainties and questions about how the future will be. But there is one thing which we are absolutely sure: the future of our businesses, the future of healthcare organization will experience changes, transformational changes, not only in digital, but also in other disruptive innovations that we have all experienced. And that has been really driven also by the pandemic. But the healthcare industry and a number of our other organizations had been working on a number of innovation process, discussion. Always think that technology is a way ahead and there is no coming back. We have a large country with structural differences, and the pandemic has shown a lot about that. And we have a number of possibilities. Technology and what's available today in the world has really provided us the possibility to say that we can have a more sustainable healthcare with better quality and more possibility to offer quality of life to the population who's living longer. Five or 10 years ago, we discussed that people would be living longer, would have more comorbidities, they would be more concerned on quality of life, realizing that preventive medicine has to be our main focus. And of course, we cannot speak about personalized care, genetics and genomics without addressing technology for digital transformation. We have here today two companies which are reference in healthcare, and we are going to hear from them what they've been doing and how digital transformation can generate and bring more value to our clients, and what we would like to hear what you have been observing for the past year. And what are your plans for the future? Let me start with you, Armando. Thank you very much for being here with us today. You are on mute, Armando. Well, Lídia, such a pleasure to be here in the panel. It's a pleasure to hear you. It is an honor to be with you here today. I am going to start talking about the transformation of healthcare. What are the main vectors that are promoting healthcare transformation? Thanks to the revolution we've all experienced in medicine, people are living longer. In Brazil, we also have the triple load. So parasitic, infectious disease, lack of sanitation, violence. And finally, the degenerative chronic diseases. But regardless, people are living longer. In addition to that, there is an increased awareness of citizens, of people. We want to manage our health, prevent potential diseases. And of course, COVID has really given impulse to some changes. A CEO of a hospital has recently told me that people had, some of them would undergo tests or results and would never collect the test results. It has changed now. People are really more focused on managing their own health, and it has really been, it's a reality with the pandemic. And so much is said about that, especially in the media. I have recently learned about longevity. Throughout our lives, we are impacted by diseases that can be cured, whereas when we are older, we also suffer of diseases and eventually end up dying. But much has been said about lifespan as well, where diseases are less frequent. All strategies of prevention based on data, based on artificial intelligence. And the morbidity stage will be compressed, increasingly more compressed in the last years of our lives. So longevity, we are going to live longer with higher quality of life and compress morbidity when we are close to our last days. This is the dream of medicine in the future, effective health management. To get there, there are three main pillars. We should go into expanded diagnosis, and there are three pillars, as I told you. So, digital world having the ambition that each and every citizen would have a information, a system with all the information about health, including simulation of treatment, also to provide clinical solutions. So the decision is always in the hands of physicians, but the more information we have, and the more information we have about the history, so much the better. So this is one pillar. Secondly, precision medicine, minimally invasive medicine, so that we can treat people at the right time, at the right moment, and this is fully individualized. Finally, data use and how we can provide interoperability and the benefits resulting from them. You can work with a series of predictive algorithms. It goes beyond prevention. It goes into not only predicting, but prevention. And we can select groups that need added support. So all towards longevity, living with enhanced quality of life. And once again, all of that to support clinical decision-making. I would also like to take this time to tell you more about the catalyst action that was the pandemic. There are a number of tools that have always been in place. I don't think it's necessarily technology, but our willingness to use it. Telemedicine. My father used to be a doctor. My brother is a doctor. My father used to give recommendations over the phone, then saw them in his private practice if he knew them, of course. Today, we can see people, we can talk and interact with them. But it started being used once we had no other option. And a number of other services provided at Siemens Healthineers. Whenever there is a new device offered to our clients, we teach them how to use. We teach to explore it as much as possible. We call it application. It used to be on-site, although it could always have been remotely. Now, of course, we are just doing it remotely, training them on to use new machines. And clients told us it was even better. And rather than having 5 days and radiologists might not have, let's say, enough time to be with us for 6 hours a day. So we just broke into smaller chunks. So presented one initial piece of information protocol, the person tested, then could review the next day. We've been using augmented reality to fix devices. And it all happened because we had no other solutions. Of course, the pandemic has been horrible. But what we have learned, we will try to maintain and use the best of the two worlds. Acknowledge the benefit of telemedicine and a number of algorithms that we can build that will provide a solid, robust support for clinical decision-making. Understanding the health continuum, which is something really important, from prevention to treatment and just monitoring the patient's journey. So how can we have it all protected, but at the same time well structured, because the benefit is non-disputable? These are things that we have to do correctly, and we cannot simply postpone and expect a new pandemic to come. Fortunately, we had the tools in place and we could use them. But there are a number of capabilities that we have to build to have a VUCA world. And then we will be prepared to work with them no matter what comes. Great. Thank you. Thank you, Armando. I think you've made it very clear about what we've learned and also about the future. The importance of healthcare, diagnostic medicine. At Hospital Sabin, at our group, we have also experienced a change in the profile of patients. They are really concerned about preventive medicine. And here at Sabin, throughout the year, we've seen a change in the profile of the audience that needed our services. And we could see the age range, primarily of men that used to come. Well, children come to be tested with the mothers up to teenager years. Then men just, women comes at the age of 18 and up, and men just come back when they are 40s, when they are in their 40s and start performing checkups, provided that they have no healthcare issues. But we've seen a change in profile. We now have younger people, people who are in their 20s coming to our services. undergoing medical visits and also diagnostic tests concerned about prevention, which is something that has also been brought by the pandemic. And the pandemic has shown that we have to invest in prevention and quality of life. Because then if we have an infection or anything, we can be personally uh, prepared, healthier to deal with any issues. So this is something that we've observed, younger people coming to us. Let me now hand it over to Guilherme, who is going to tell about the topic and his experiences. Good afternoon, Lídia and Armando. It's a pleasure to be here with you. Thank you for the invitation. I think what you were saying is right to the point. We've been emphasizing a lot the improvement in quality of life, transforming medicine from treatment to more diagnostic. With the pandemic and everything we've been through, I think we have taken a higher leap, greater leap, going from diagnostics to prevention. There were many campaigns ongoing, and the pandemic has really increased the number of patients coming for prevention care. Everyone has access to internet, and we know that people were constantly searching for information, but there is such a overload of information, sometimes they don't know what's right and wrong. So being in closer contact with the doctor or the lab is good, because then they can have better reference. They can have a, let's say, someone they can resort to, trustful sources, of course. We know now who should we ask for when we need information. As you have pointed out, the pandemic has laid bare a number of problems we have. Thinking in Brazil, accessibility, and there are regions in Brazil that maybe didn't even hear there was a pandemic. And we have to deal with a number of situations. I think that what really concerns digitalization is exactly there. Make medicine come closer to us, having patients really fully aware of their health, paying close attention with what's going on, and thinking about two things: what is going to be to the physician, what's going to be to the patient. Thinking about telemedicine as a reality, the number of other tests rather than COVID really dropped in the first year. First, because of the number of tests that the labs received and they had to get organized. But secondly, we've seen that people they were afraid of going to the lab because of the pandemic, because in the lab there would be greater risks, more people who were sick. These technologies were available, but people were looking for options, looking for ways to being treated, to be taken care of in the pandemic. So new technologies will come into play to give more information. Now we know that the smart watches are really common. We use thermography, some easy and wearable technologies. At Seegene, what we've been developing, because we are developer of technology for diagnosis, and we've always been focused on making a diagnosis, closing a diagnosis. We wanted people to really know what they have. And we've been thinking about a number of possibilities for patients and for labs. We've also detected the importance of developing Brazilian technology, our own solutions. We tend to use what comes from abroad. We are a multinational company, but sometimes what applies in a system in Europe or in the US is not exactly what's going to be appropriate for our own reality. And I think that this is something that the pandemic has shown us. We have to address our reality, rely on our resources. We've been developing things with in partnership with Brazilian companies. So less invasive tests, self-collection, patients that can collect a sample at home and take to the lab, integration of results through apps so that they are accessible to physicians that can really access them. Also, commuting, so how to get to regions which are far away from the large centers. We have a project which is to grant access to labs, to physicians, and to Brazilian hospitals so that they can develop their own solutions for them to use all this digital framework that we have created in panels that would meet the reality of that specific community. The natural progression of it all would be to generate high quality data to really serve as input for both sides. On the one side, patient, on the other side, the service center, hospital. Telemedicine is excellent. You can reach a patient in situations that were never thought before, but at the same time, you need rich information to provide a treatment solution. So it's a whole myriad of things that come from digitalization. So provide enough data for a patient to understand the situation. So that can be done through home collection, less invasive methods, really making it accessible. In addition to diagnosis and treatment, this is what is going to help us leverage further prevention, thinking about longevity, quality of life, and the trend. And just saying a lot about that. about data that is going to be generated in our daily practice. This is what we've been trying to do, really have personalized and something which would be much easier for the lab and accessible to everyone. When we think about that, and we think about the beginning of the pandemic, we've had problems of supply chain, not only inappropriate uh, access to machine, but also PPI. And a lot has been said about the national industry, investments in science in the country, the campaign of immunization, and what has been in Brazil. Because we have reference centers and what we have for different vaccines in Brazil. This is also a legacy of the pandemic, and we as leaders in our organizations, which are representative in the country, we really have to focus on that, building together with the government and other companies, forging partnerships that can really encourage national investments in research and science. Uh, really invest in research, science, and education. We talk a lot about digital transformation, innovation, but we've also been realizing that we don't have enough technology professionals with training at a technical level and higher education level. So I would like to hear from you whether you've seen that in your companies. What have you noticed in the market in terms of access to talents in the area of technology? Do you think there is a shortage of qualified professionals in these areas? And how have you prepared your companies for the future? When we're talking about digitalization, so we really need professionals who are qualified.
Well, you're totally right. No doubt, we look at our country, we have a high rate of unemployment and areas and industries where we have lack of professionals, and also in healthcare. We had a great issue during the pandemic so that we can provide access to our 220 million inhabitants. We must have strategies that are not only training, education, healthcare, technology professionals, but also to have tools that allow you to leverage and maximize their work. So an example that we have, you can have MRI remotely monitored. People can take care of both, or you can ship the equipment and AI tools that allow tests to be conducted faster. So the sum of what technology can provide and the support in training people, actually we were talking the other day, the training of healthcare professionals. I make a comparison that is kind of naive. What the scientific calculator means to engineers, we need to continue, obviously, with the money, knowing what concepts to apply. But it's a fantastic tool for doctors, healthcare professionals. AI will be a great tool to be able to care for more people with better quality, more speed, and so on and so forth. So they are important tools, and we need to learn how to use them appropriately. And I'd like to, before I hand over to Guilherme, I'd like to address another topic that I think it's super important. regarding reducing waste that we see a lot happening in health. How can we leverage the engagement of citizens, patients? This goes through, as Guilherme mentioned, we have a lot of things generating data, small devices like oximeter, smart watches that people say that it tells you how long you've slept, how much exercise you've done, etc., etc. Look, so we have an image that if we create a layer where the data is actually loaded, how much can we savings can we have in terms of saving that could be actually expand access for more people? So it's a personal history. My mother, during a certain period of her life, then she underwent several surgeries, and then we had another one, another institution. And then I got there and they asked, oh, then I can ask her, what do you have? What's the matter with you? She was able to tell 1/3 of what she went through. Then I told the other third, and my brother told the other third, and so on and so forth. If all this record were available, we would avoid not only telling stories, this is not an issue, but obviously some information could have gotten lost halfway and important for the other procedure. Just as we look at the beginning of the continuum of health, people that wear a smartwatch, how much are they motivated to doing more physical exercise, caring for the time they go to bed, they wake up? For you to have this information available also helps in this virtuous circle for you caring for your health. Somehow you're almost playing a game on that. That's another aspect that I consider very important. And then I'd like to ask your permission first to tell you a bit of what we're doing at Sabin. Today at Sabin, we have a data platform for image, for clinical tests that is established. What are the benefits that we perceive? The access of citizens and patients to information is very simple. They have everything in the palm of their hands for doctors. And this is ready for us to start plugging some algorithms or adding some algorithm on top. For example, an algorithm that reads images and helps radiologist in his report. So they process everything, they can actually add information and make information available. In other words, building other attributes of value becomes not easier, but feasible, and also provide space for you to be able to, it's the quantity of information is infinite for you to build value on a system like this. And then again, you're providing a playground so that more people can be trained, more people can be prepared, both from the technological standpoint of health management, to be able to bring these benefits. So I'd like to close your question. So saying training of people is knowing what exists and give space so this creativity can be exercised. And Guilherme, you brought up a point that is quite interesting. So we are used to consuming what comes from abroad. We will have conditions, as in many cases today, that we create solutions here and we export the solutions. And we have some unique advantages in our country. For example, diversity, genetic diversity. We have people from all over the world living here. The word of Hospital das Clínicas is mapping people. You know that the diversity, and this for you to train an algorithm, it will be much more powerful because rather than what a person tested with a sort of single feature, and it gives room to prepare us or to prepare people to be highly qualified, having both things together to our country and abroad. Thank you. Perfect. Thank you very much. Guilherme? I'm going to try to follow what Lídia mentioned. I'm a biologist. My profession has never been so has never been so valued as it is today. Thinking about training of professionals, we have a lot of opportunities. Actually, we have excellent universities. We have professionals with excellent training, but what I think is lacking, something that we've been trying to do, is greater participation of the private sector in universities, something that happens a lot in Europe, in the United States. You have very good professionals in technology, databases, handling information, etc., because they bring this demand into the university, into research centers, and then they develop professionals that are very competent. This is what we lack. We have the minds, excellent people, we have excellent universities. What we lack is taking these demands so we get to this, that the more technology, the more development that we have, greater opportunities we have for people to work with universities to develop those professionals for these markets. They are new markets. They know quite well what they are like. I have a degree in biology and diagnosis pre-pandemic. We know what it was like. So we're still starting. So we have professionals that were not prepared for a market that did not exist in Brazil. So this is starting. So the idea is to have private initiative adding to actually prepare specialized labor for the demand that will be increasing. And what actually Armando mentioned or commented, thinking about the professional side, we're also at the rush to get information, to obtain information, and then we have to be careful with the quality of the information generated, and also we have to see what to do with so much information. So today we see, for example, you have MDS panels mapping the whole genome, and what do you do with all that? So this generates a need on the side of professionals and doctors how to work with that. And digitization helps a lot for you to have a group of professionals working on the patient. And we know quite unlikely a single professional with a single type of training will help with all that information, considering the quality of life of patients. We're talking about several specialties, the clinical record of the patient, everything on a single place. We can have a team of professionals working on that. And this incredibly increases the quality of the care the patient will get. And the need of professionals could be more generalist. So dealing with all that information and give some direction. So we have this gene, okay. And what do I do with this piece of information? Where am I going to head to? So sometimes we're talking about not the gene. When you think about the whole genome, so 100 pages of report. And what are we going to do with that? So this is something we have to grow in parallel. Data generation and also how we deal with the data. Are we going to use that in the best way possible and turn this into something palatable for the greatest person interested, who is the patient? Thank you. Thank you, Armando. Thank you, Guilherme. Very good. So when we think about digital expansion, innovation, we went through talking about the importance of professionals, and for us to finalize this panel and thank Armando for all the contribution, for his vision, Guilherme too, arriving. The flight is delayed. He was able to get to take part. Thank you very much. And I think also this is a legacy that we have in this pandemic that will be very important for the future, which is collaboration and cooperation projects. So here we are representing 3 companies, Sabin, partners of Seegene, Siemens. That's important for our projects, our businesses, everything that you have been doing, have been developing, the investments of the companies, of your companies, to us on our side, be able to offer better solutions and new business models to our clients, patients, and clients. So if we look into the future much more with this vision of collectiveness, cooperation, and collaboration, I believe we'll manage to get faster results and the population we gain from that, the country. I've been with Armando this morning at another panel where we talked about how much our country has 210 million inhabitants, a growing country that will need a lot of health, complementary health care. We have 50 million lives, 150 in public health, and how much all these people require increasingly more health. We have a lot of challenges ahead, but no doubt many opportunities, and we know how much our companies can and need to be protagonists at this time, post-pandemic, I would say. I do hope that, in fact, we are going through them, leaving them behind, then learnings remain, legacy remains, and we have ahead of us a lot of good fruits to reap from everything that has been invested in all the work of all our companies. Thank you very much, Armando. Thank you very much, Guilherme FIS. Thank you for this opportunity. We do hope you have contributed to the event of this week. Thank you all very much for having attended us.